Here, Genesee Health Plan experts explain Medicare, Medicare fraud, and how to protect you and your loved ones from being scammed. Focus on Health, Medicare, and Medicare fraud.
Genesee Health Plan has partnered with the Senior Medicare Patrol in understanding Medicare fraud to inform you on how to protect yourself. Jill Alexander with Genesee Health Plan will explain what you need to know about Medicare.
Medicare is a federally funded health insurance program. You must be 65 or older or deemed disabled for at least 24 months. Then automatically you'll start receiving the Part A and Part B benefit. Whereas Medicaid is a state-funded program that covers all ages. However, Medicaid and Medicare do work together. There are Medicaid programs that help offset the Medicare costs, as well as spend downs, the Part B premium costs. So they do work together, but are completely separate. Medicare Part A coverage, it is usually free. It's through your work credits throughout your lifespan that pays for itself. However, with the Part B premium, which is for your doctor's needs, specialists, things like that, that is currently monthly amount of $185 that comes directly out of your Social Security check. But there are Medicaid programs that help offset that cost if you qualify for that. We can help you with that process as well. So there are costs associated with the Medicare plan, but there are state and federal programs that help offset, especially your prescription, the Part D plans, and the Part B, which is for your doctor's visit specialists, so your maintenance Part B plan. Hospitalization is normally at a zero cost due to the work credits, so you've kind of paid for it throughout your lifetime. We can definitely help you assist in guiding you through what you would actually pay personally. So once you turn 65 or you're deemed disabled for 24 months, it should come automatically to you through the mail, and then it's your due diligence to opt out. I strongly recommend to never ever opt out, because when you do need that coverage, then there are penalties involved. Once you opt out, each month you receive additional percentages and penalties. Those penalties never go away. You will receive a Social Security letter envelope on top of all kinds of other mail, health insurance plans, wanting your business, wanting your participation. I would say throw all of that junk away and only focus on the official documents through the Social Security Administration. Your Medicare card will come through the mail. It's a paper, red, white, and blue card, and it will be in like a half sheet, 8x5 envelope. That's primarily what you're looking for. Disregard all of the commercials, the phone calls, the emails, and the junk mail that come to you as well. So your spouse would not have to enroll into the same plan as you. You and your spouse would have separate accounts through the Medicare.gov. So it's very independent, which works in your favor because you can find something that best suits your needs, whereas your spouse could find something that could best suit their needs. Due to the aging in process of Medicare, 9 times out of 10, you don't share the same birth year and birth month. So that timing is usually never in sync when we're dealing with married couples. So you would not need to wait for open enrollment to start your Medicare benefits. You should receive paperwork in the mail from Social Security up to 3 months prior to your birthday. Just keep an eye on that mail. As soon as you get that Medicare number, you can call us here at Genesee Health Plan and we can start the process. That way, the first day of your birthday month is when your Medicare will become effective, unless you opt out of that. Don't do that. But once you receive that card, we're able to pre-enroll into a plan. That way, the first day of your birthday month, you'll be active with your new plan and your new coverage. If you don't receive your Medicare card, you can either go to the Social Security Administration office. However, the Social Security website is very user-friendly. You're able to download a PDF of your card as well as request one to be mailed to you. Your options are very unlimited when it gets into the Medicare world. It is extremely confusing. So I talk about A, B, C, and D plans. Those alphabet letters actually go into L, K, and M plans. So there are Medicare, Medigap plans, there are Advantage plans. So there are hundreds and hundreds of options for you. So it does get overwhelming and confusing. You'll receive a lot of mailers, phone calls, emails, even TV commercials promising, flex spending benefits or additional credits. And so all of this may seem appealing, but it's definitely best to speak with a counselor who has an unbiased, a nonprofit. Genesee Health Plan does not charge for any cost related. We don't receive any commission. We're definitely here for your best interest and not for any of the insurance companies involved. So an Advantage plan is what they call a Part C plan. I describe it as retiring your Medicare card, your red, white, and blue card. So you just put that in a safe spot for safekeeping, so you know your Medicare number, but essentially you would enroll into a big brand insurance company. Those plans normally cover all the bells and whistles. So you have hearing, vision, dental. So it's kind of an all-in-one package. And you would essentially just go through your Blue Cross or Priority or whatever the insurance company that you enroll into, and you would just present that one card for all of those services that are included in that. Genesee Health Plan has been in our community for almost 25 years. We have years of experience, and we work for your best interest and not for anyone else's involved. If you or a loved one have any coverage needs, not just Medicare, but Medicaid, Marketplace, or have an employer's plan that you're receiving bills and you're not sure why, or you're up for open enrollment through your employer and need a breakdown or an explanation of that plan benefit, we can help you and coach you through that process just so you know exactly what your plan year and your expenses will be.
A big thank you to Genesee Health Plan Enrollment Coordinator Jill Alexander for providing such great information on Medicare. Remember, if you or your family need help with enrolling into healthcare or understanding your benefits, call Genesee Health Plan. Their caring staff, like Jill, are waiting for your call and are happy to assist. Next, we will be hearing a recent example from Rati Sajia about what would be considered Medicare fraud, as well as detecting, preventing, and reporting fraud. Let's listen in.
So some examples of Medicare fraud, I will tell you using a story. Last week I got a call from a lady and she was reporting a situation that her mother experienced. So the beneficiary is the mother. She receives a phone call and mother is living with dementia. And on this phone call, she's told that they want to send her some medication and they want to confirm her medical information as well as the private information. So they get to confirm her phone number, they get to confirm her address, her name, and they get to confirm her Medicare number. And they say, we're going to send you this information. Day 2, she gets a phone call and they say the package is just arrived. She sees the package, she brings it home, she doesn't do anything with it. But we're going to come and pick up this package tomorrow. So one of the children comes to check on mom and finds this package and thinks, oh, maybe the other sibling may have something to do with it. But the other sibling says, no, I have nothing, I didn't order anything, throw it in the trash. So they throw it in the trash and they leave mom's house. Third day, mom gets a call and they're like, we want to pick up the package. Have you done what we asked you to do? And in this case, it was a swab. It could be DNA test, it could be genetic testing, it could be COVID kits, any service that they can charge for, they can do this. Mom says, no, I haven't done it. They walk mom through this process and mom fills out the form, she signs, and what she's signing literally is to say, if Medicare doesn't cover this test, you're responsible for the bill. Day 3, one of the children comes to check and finds the trash can is empty. When they talk to mom, they find out that when mom was being walked through this, someone was standing across the street watching her complete these steps as they were walking her through it. And they tell her to go put it in the mailbox, someone will be there to pick it up. That looks like a simple example, but the types of fraud that have been done here is they've applied the pressure on mom to get her to do it. They've walked her through a process, taking advantage of the fact that she doesn't know better and she thinks she's being compliant because she's going to miss out on her medications, right? So it's the pressure. Now she's going to be facing a bill that she doesn't know. And so with that, when they call us, we will advise that they call Medicare and let them know that the number has been compromised. And then we'll also let them know to look at their summary notices and really monitor them more closely now, because should they charge that immediately, that's going to show up in mom's statement. Those are some of the calls that we receive for, and it can be braces as well. It can be catheters, and catheters are different because a lot of the times beneficiaries don't receive any of these packages sometimes. So if you're not monitoring your Medicare summary notices, what's going to happen is that 10 months down the road, you will find that you have anywhere from $20,000 to $50,000 worth of catheter charges for catheters that you don't use. Medicare fraud occurs when providers that are billing Medicare for services that they should not be billing for, that they did not provide to the beneficiary, or they may be billing for services that are more expensive than the services that were actually provided. Medicare fraud also occurs when scammers are the ones that are also billing Medicare for services that were never provided. We should all be concerned about Medicare fraud because it costs the taxpayer approximately $60 billion a year on unscrupulous charges. Now, Medicare is supposed to be providing services that beneficiaries can benefit out of, and everyone is paying into the system hoping that they can receive services that are appropriate when that time comes. But instead, we see that premiums keep going up because money is being spent on the wrong providers that should not be getting this money. So we're all invested in making sure that we're reporting Medicare fraud because it affects all of us, whether it's premiums, whether it's co-pays, whether it's services, because it also distorts the beneficiary's healthcare history when that is happening because they end up paying more out of pocket than they should be. The potential signs for Medicare fraud involve phone calls. When you start receiving relentless phone calls, that's one of the warning signs because they're asking for your private information and they want that information because that's how they get to bill Medicare fraudulently. Some of the warning signs also include the door-to-door visitations from representatives that claim to be from Medicare. Some of the other warning signs is when you're being pressured to sign up for services that you don't need, first of all, that you potentially may find yourself in a service that is not appropriate for the care that you need or for the kind of support, Medicare support that you need. Some of the warning signs may also include mail that you may be receiving, supplies that you may be receiving that you didn't ask for, doctors' names that are on your Medicare summary notice that you don't know about, or services that are being charged that you don't know anything about. So those are the warning signs that Medicare beneficiaries can look out for. And I think the most frustrating warning sign is those phone calls that are relentless. They are very frustrating for our Medicare beneficiaries because you can't focus at home if the phone is constantly ringing off the hook. It makes it difficult to not pick up the phone. And then when you pick up the phone, a simple question like, is your name so-and-so? And you say yes, and suddenly you find yourself signed up in a wrong plan because you said yes to your name. DNA tests and genetic tests are some of the tests that doctors may use to determine if someone is at risk for some of disorders or diseases, right? Looking at the history, when they don't know based on your history, they can use those tests to determine what's your risk factor. So they may, but the good thing about the doctors is that when they do that, it will be in consultation with you. So you'll be consenting to those tests and you know why it is being done and you understand the reasons why it's being done. So yes, they can order them, but they should not be ordering them without a consultation with the beneficiary who is agreeing to this test, especially if they're not going to be covered by Medicare. scammers, believe it or not, the easiest way for them to get information from beneficiaries or concerning beneficiaries is through the phishing calls. So it's those calls. We're easy to give that information, and we give it accidentally, again, because of the pressure that is applied to beneficiaries. You know, we like to do surveys, right? And so we click on that information, and guess what? In order to proceed with it, sometimes we need to give in our name, we need to give in our address, we need to give our number. The other ways that they get this information is also for identity theft as well. If it's not phone call, it's mail, it's emails, it's surveys, and the beneficiaries, they end up just being victims. No one from Medicare will ever show up unannounced to your door because Medicare communicates by mail. So if they're coming, it's because they have already made an arrangement with you to be there. So if someone comes at your door pretending to be Medicare, tell them that you would like to confirm this appointment. You're going to call Medicare first before you engage them in this conversation. And if it's a phone call, hang up. Let them know that you're going to call Medicare to confirm that they're the ones that are calling you, and you'll take it up from there. You want to always use a trusted resource for that communication, that phone number, because scammers also disguise the numbers that you see on your caller ID. It may say Medicare, but it's not Medicare. So you want to be the one that calls if you didn't already make that initiation. What I want to say to beneficiaries, if they receive any of these supplies that they don't know anything about, call us and we'll provide guidance. What we will be advising them to do is call your healthcare professional first and find out, just in case maybe, you know, they had it in their mind and the conversation at the visit went some other way and they ended up not bringing it up, but they understand that you need it and they may confirm at that point. And if they didn't, then you can call us and let us know that they didn't, and then we will be asking for the documentation that came with that equipment. So whether it's knee braces, there's usually like a provider that is involved, a doctor that is signing off, and is definitely, if it's not your family physician's name on there, that's already a red flag on its own. And so we will tell the beneficiary that they can call the number that is on there, ask for a return slip, mail slip, and then they can return it. If it's a legitimate error, that should not be a problem. But if it's not an error and they're just trying to capitalize on the beneficiary's healthcare services, then we will tell them that they can send us that documentation. We work with the Office of the Inspector General. We provide the documentation so that they can do the investigations. So they want to be able to provide us with the names that are concerning that alleged fraud, addresses that may be in the packages. So we would ask them either to take pictures or fax or email them to us. So the Senior Medicare's mission is to educate and empower Medicare beneficiaries in order for them to be able to detect fraud, to prevent fraud, to detect fraud, and to be able to report. And this is done for the Medicare beneficiaries, their families, and their care providers. And this is done through education activities, outreach activities, and counseling. So the Senior Medicare works with volunteers to provide this education so that beneficiaries can be aware of the types of fraud that are in their area. We encourage them to call Senior Medicare Patrol whenever they're not sure about what is happening, and we'll help provide that guidance. Whenever a beneficiary or a family member or a care provider suspects that there is Medicare fraud, the first thing we suggest is that they call the Senior Medicare Patrol, and we will assist them in reporting or even to understand. Sometimes it's simple errors. We may suggest that you call your family physician or whoever the number is showing as the entity that concerns that error. And if it is an error, they're usually good about fixing it. Now, the concern is when it's not an error and you're not getting a receptive response from the other end, and then this is where then we need to report it as a potential fraud. When it comes to prevention and detection and reporting of fraud, it also includes the care providers as well, the doctors. So what I would encourage the doctors to do is making sure that their recording and documentation of these visits with their patients are thoroughly done and that they are accurate. And also I would encourage them to be reviewing their own statements for recording for the beneficiaries. They're also a very intricate member in trying to educate beneficiaries about fraud, talking to their clients about determining and looking at their Medicare summary notices with them to make sure that there isn't anything that they did not provide that is showing up. A lot of the times beneficiaries are scared to report some of these instances because they don't want to get their doctor in trouble. But if the doctor is on board saying no when it's not right, if it's not my name, and if it's showing my name but you don't remember the service, come talk to me and we'll figure it out. Then the beneficiary knows that their doctor is a good doctor and they can talk about this, and if they're not getting the right answers, then they can always reach out to us as well and we can help alleviate some of the confusion. So when someone is scammed, and it can be layered in that it can start off with the name, it can then when you add the Medicare number, now you're moving into medical identity theft, right? And with medical identity theft, there's also the financial repercussions to that, because if someone is using your information and going to get services, guess who's paying the co-pays? It's the true beneficiary.
If you or your family need help with enrolling into healthcare or understanding your benefits, call Genesee Health Plan. Their caring staff are waiting for your call and are happy to help you. Thank you for watching.